Okay, I'm going to call the March 9th, 2022 Diversion Center Board meeting to order. Can we get a roll call, please?
Dr. Boutros?
Here.
Crystal Bryant? Here. Chief of Staff Mason?
Here.
Randy Carney here. Donna Weinberger?
Here.
Joan England?
Here.
Chris Julian?
Here.
Dr. Perrin?
Here.
And we do currently have a vacancy which was held by Chief Williams from the Cleveland Police Department, but I have reached out to Cleveland for the replacement to be the new interim chief, Chief Drummond, for this board.
He's going to be running a little bit late. I got a call from him right as I was walking down.
So do we know if he was appointed or not?
It has not been appointed yet, just agreed to the process, so we still have to complete the appointment.
Okay, great. Do we have any public comment?
Yes, we got a couple, Jen and Larry.
First one?
Jen and Esky.
Hi, would you just please state your name, your affiliation?
Sure.
And welcome to the Diversion Center.
Thank you. My name is Jen Lasky, and I'm the Executive Director of the Edna House for Women, located on West 65th Street in Cleveland. In early January, the Edna House staff was able to tour the Diversion Center. It was at this time that we learned that the Diversion Center was available to the community without utilizing law enforcement personnel. And I want to thank you for this, because I believe it will maximize the use of the Diversion Center, and the people most in need of services will get the help that they need. I'm a former state parole officer and the director of a men's reentry program, which has allowed me to view many agencies and institutions. I can say that I was impressed with the facility, the staff, the cleanliness, and the location. I only refer people to places that I have been, and I feel confident advising the Cleveland community to use this as a resource. More importantly, I know if I send someone there to detox from the Edna House, that they will return to the Edna House for our 6-month residential program. That is not always the case with other detox facilities that will detox the client and then encourage them to utilize one of their many IOP or PHP programs. So I want to thank you for all that you continue to do for the Cleveland community.
Well, thank you, and thank you for all you do at the House and your staff. Thank you very much. There's someone else?
Yes, Larry Helter.
Larry?
Hi, Larry Heller, Northern Ohio Recovery Association. And first I'd like to share something I have shared in a couple other meetings, but not in this one. I do have the opportunity to come in contact with some of our most vulnerable residents out in the streets. And I have had the opportunity to come in contact with a number of people who have been to the Diversion Center. And I'd like to share with this group that a lot of people, even if they did not stay incomplete or did not stay for a referral, have reported that they did benefit from that stay, whether it's merely just getting resources that they didn't have before, or whether it's knowing that someone cares, or maybe it's just finding hope. And most of them report they probably will use it again. They will share the information with others to use it. And everyone I've talked to reports improves quality of life by some degree because of their experience there. Okay. Also, I do have a couple other comments, but they pertain to agenda items, so I'd like to reserve those for later if that's okay.
It's typically at the start of the meeting, so.
Oh, okay. So also I want to inform this board, Rosie Delphi, who's the liaison for the new Community Input Committee, just texted me. She's running a little late. She will be here to share her report when she gets here. But regarding that report, there were a couple items. I think Claire is here. She was kind enough to prepare a nice big summary of the report that I hope all of you have received. There were a few other things that we did discuss among some of the members of our Community Input Committee. And I just had some additional notes that I would have preferred to do after the report. But some of our notes include things like clarification as to the charge, clarification as to definitions, Like, what does community input mean? Does it mean we allow access to anyone who comes, which means that they have to not only know what to look for, where to look for, and have access? Or does it mean we intentionally seek out underrepresented people, or previously underrepresented and underserved populations? And also on diversion, since this diversion center started as point one in the sequential intercept mapping, police diversion between police contact and arrest, but now has already expanded to include some zero intercept, and hopefully we're talking about also point two, maybe after central booking, there might be a second chance. Do we want to expand our definition or our expansion or understanding of what diversion encompasses? Thank you.
Thank you. So Larry, let me just, maybe if I can just summarize your two requests for clarification. One is what are we looking for from the Community Input Committee? And regarding the makeup, is that one of the questions?
Yes, what do we seek to achieve?
Yeah, and the second one is are we looking for further progress for the diversion center to be included along more of the intercept continuum, right?
Okay, maybe I may phrase it as not only the community input, but maybe also this board to consider expanding the charge to go beyond just the diversion center, because diversion certainly includes a lot more than just the center, because we are now realizing there are other intercept points.
Understood. All right, so let me just, maybe I address the second one before I address the first one. The second one, there's a charter for the diversion center. It was established by the county and county council. So if there's any suggestions to expand that diversion center scope, you should probably send it to them for their consideration regarding expanding the scope of this committee. Regarding the community input, and I'll just ask any of my colleagues to respond as well if they need to, or if they wish to add to it, is that the community needs to decide who in the community should participate. We have lots of people representing different groups here. We have a lot of expertise, medical expertise and other expertise. But I think who gets involved in the community committee and what do they offer us as guidance or input, that's really up to the community committee. I would not want to be able to say certain people shouldn't be involved or certain people should be involved. Anybody who wants to be involved, the community committee, input committee should include. And anybody else? Crystal, Okay, so I think addressing these two things, we'll go into the voting items. Are there anybody else? I apologize.
That was the only two that signed it.
Okay. So I'd like to go into the voting items, which the first item is approval for the minutes of November 4th, 2021, last year. May I have a motion for approval?
Motion to accept?
Second?
Second.
Any discussion, input, corrections? All in favor?
Aye.
Opposed? Motion carries. Item 2 is virtual attendance option for board members. Do you want to take that? You want me to take it?
Sure, I'm happy to if you like.
Okay.
I think many of you know that late last month, the governor, the governor's office, I apologize, had signed an extension to allow for virtual meetings till the beginning of the summer, so June. So really that would only impact our board at this time for one of our meetings, the May meeting. And so the question was whether we want to allow for having a virtual meeting in May rather than an in-person meeting. And that would be the only one that's impacted at this time.
I think everybody's here. I think it would be good to see everybody again if it's okay, and if it's if we get which we will not get another spike.
No, we won't.
If we can revisit it. Is
Yes.
that okay?
Absolutely.
All right, good.
I don't know about another spike, the only challenge for me is that elevator.
Oh, yeah.
They're really over-engineered.
There's no button.
So I'll meet you downstairs and bring you up. Okay, so, agenda item, 5A is the, update from, Dr. Perry.
Good afternoon, everyone. You should have the PowerPoint, and it's also on the screen. So before we move forward, I put that statement up there because, as it says, good art is art that allows you to enter into a form of angles and to emerge with a variety of views. And as we've seen, the Diversion House Center has certainly evolved into different views. Now you can self-refer, the community can refer, and possibly we will be looking at other ways to get our numbers up. I enjoyed her statement. It is a beautiful facility, and it concerns me that our numbers aren't higher. And I think part of it is really grassroots, getting the word out. You know, I'm used to putting things up on the grocery store bulletin board and going church by church. So I think we need to look at arming ourselves with the material and really good at getting the word out. The next slide, please. So we've looked at the types of intake and referral, and I'm talking about the last quarter of last year. So you can see community started in October, and you can see in November and December that the community has been referring loved ones, friends, family, and bringing them to the diversion center. There is also the police referral, the pre-arrest, and you can see those numbers. And then the self-referral has taken off. I was at the Orianna House on Diversion Center on Monday, and we talked about the self-referrals and the many reasons people can self-refer. One is a parent says, you know, you either get help or you can't live here. So there are many reasons for self-referral, but it's working. But we do not want to lose sight of the police referral. That's very important that we keep that in mind, that the original reason for the diversion center is to, one, keep people out of jail for misdemeanors, and for the police to bring them to the diversion centers. So I think more insight, I actually put out a feeler, haven't gotten a response yet, from a friend who knows many policemen to see if they've heard about the diversion center and their response. And I will certainly report on that next month. The next slide, please. The next slide speaks to the officer pre-arrest referrals. It looks at the Cleveland districts and the other districts. So we still have a ways to go with the Cleveland districts. We still need to make sure that they have gotten the word and possibly find out where they're not referring like we thought they would. There may be reasons, and we may talk about that. The next slide talks about the staffing overview.
I'm sorry, can you just, if you can just go back for a second? The pre-arrest is the, no, can you just go back one more, please?
Okay.
Can you go
Gotta
back
go
one
back.
more
Can you go-
slide?
Oh, I'm sorry.
The pre-arrest is the brownish color?
Yes.
Right? Is that correct?
Mhm.
So it says 7, 12, 8, right?
Did I add that?
Yeah, 7, then 12, and 8. And then if you go to the next slide, it adds up to 9, 11, 7. So I'm just not sure which one numbers are which.
I have,
And if you want to take time to
yeah, let me.
fix it, that's fine. Just if you can just see what the correlation is.
9, 11, and 7, I have 27. and 27.
Yeah, it doesn't add up. It says that there were 9 in October, where it says there were 7 in October on the other page. And then it says there were 11 when there are
I
12,
see.
and there were 7 when there were 8. So I'm just, the total is fine, it just, it
I
doesn't.
got you, it's the individual.
Yeah.
Yes, I will
If
look at
whatever
that
the
and
correction is.
make that, yes,
Thank
thank
you very
you. I think we discussed that. The next staffing overview, October, these are the needs. You can see what they needed in October, November, and December. They've had a lot of staffing challenges, and in part, it's the nurses who are able to get COVID hazard pay, and they're making much more money than they would normally make. Other problems is they need nurses for 7P to 7A, which is not the greatest shift, and at this point, they can name the shift they want and almost the money that they want to make, so that remains a problem. So yes, the hours needed, the nursing market is very competitive, and the pay rate is also an issue. So you can see what their needs are, and you will see on the following page that even though they've been under budget October and November, they were over budget in December due to 3 pays. So it looks like they're over, but it was because in December they got paid 3 times.
Can I ask? Sorry.
Yes,
This staffing overview, is this how many work there or how many?
I'm
are
sorry.
needed?
This is how many staff people that they needed each month. They needed more nurse practitioners, RNs, enrollment in progress. The other problem is a lot of times when they hire, because of the crunch to hire, they're hiring people with not a lot of experience. And that's entailing them to do more training than normal because they're hiring people without the experience, but they need the bodies.
Dr. Boutros, can I-
And because of understaffing, because of the enrollment, they're able to maintain understaffing because they don't have a lot of clients. Sorry.
And thank you. I just wanted to add, and I know Mike and I just talked about this, in our contract, we actually have set these staffing positions, so prior to opening. And now that we've been open up for a year, there's been, they've been doing the work, and so they understand what makes more sense and what they might need more of or less, or some positions such as a QA, QI. So we just had a meeting about some staffing recommendations, and they're putting together a final schedule to send to the county on what makes more sense now that they've been a year in operation, and where they might have, not have needed so many of one position, but do need more of another. So that's something we're
I
continuing.
think, as you're considering this, and this is through other contracts with the county, and I know that you have to have a cap for things, and you gotta say this is the maximum contract and all of that. I think if you can set, what is the core minimum for the running of the organization, and then there's as volume changes, there's variable staffing.
We didn't do that before, and
Yeah, that would
that's
be
what we
helpful.
learned for this time to do. That's a good point.
That is, if I could
Yeah.
comment, that is exactly what we're doing. We're basing it on if you had 10 clients in the building, 20 clients in the building, 30, 50, what are those minimum staffing numbers based on that?
So again, just to add this stuff up quickly, the budget for the third, last quarter was $726,000. The actual is $630, so it's still below by $100,000. And if you adjust it for the extra pay, it was down to $519. So they're still significantly under budget.
The next slide, please. So since our last meeting, I attended 2 CIT trainings. They are well-run. The instructors are very, very knowledgeable, and the attendance has been between 18 and 20 participants from various districts. I also reviewed the process and intake procedures of Frontline and the CIT training and the Diversion Center client records, which are in order. They're following every policies and procedures. And we're going to talk further on some of the things we looked at. But the staffing hours, we looked at staffing hours, the metrics, and the monthly billing. With the metrics and the monthly billing, we've had some questions, and we are currently awaiting some of those answers. But thanks to Brandy, I'm just looking deeper into what they're saying and why they're saying it and asking them those hard questions. So sometimes I'm waiting a while until they get those answers back to us so we can release for billing. Assisted in the revision of the Diversion Center metrics. We now have metrics that the board requested last year. Also, reviewed misdemeanors and the domestic violence and assault. With domestic violence, the Diversion Center does it or admits case by case. Domestic violence can go from me throwing a bottle toward Tyler and it's falling on the floor. That's considered domestic violence, to the extreme of me striking him and sending him to the hospital. So they look at domestic violence case by case. Also, we reviewed the client surveys. We've added an additional question about how did they hear about the Diversion Center. That will be in the new survey April 1st. That will be ready. So we reviewed the client surveys, and two things was very obvious. One, police did not explain the Diversion Center to clients. Now, certainly that's subjective. However, we still wanted to look at it, and hopefully we can encourage police to really explain where they're going and why, because that can have a great impact on them leaving at the door or leaving right after intake, and possibly we can get people to actually stay and finish the program with a better explanation. They're due, an explanation about where they're going and why they're going there. We also looked at the food. They don't like the food. And I can say that the staff really hears what their clients are saying. They review the surveys. And because of that, Levy Catering is donating meals to the Diversion Center. So the staff is a lot, the clients are a lot happier with the food.
Can I ask a question?
Yes.
Is Levy,
Levy, Levy Catering.
is that who we contract with to bring?
No, they're volunteering and bringing food there.
Yeah, okay.
We contract with Airmark for food services. Levy was, and I don't mind Elise if you want to say, Elise's father-in-law is the head chef at the convention center, right? Cleveland
Yes.
Convention Center.
Yes.
So he heard about the Diversion Center, wanted to do something, so he donates food to the Diversion Center. Yeah. So that's,
Thank you.
Just a comment, though, that's great that he does that, but shouldn't we just fix the problem?
I think we try to do a couple of things. Now, tied to the fact that I guess they don't like the food, I don't know that that's the case as much as it is they don't get enough of it. And so what we've done is we've gone out and got supplemental, snacks and coffee and things like that for them. We have increased that. But again, we do the best we can with the contract, and I think most of what at least I hear from clients is they don't get enough food.
Is Aramark contracted to Orianna House?
Yes,
So you have the contract with them?
we have a contract with Airmark, and they provide food services at all our sites.
So I mean, to the to Mr. Mason's point, you may want to provide those to, those that
Comments,
information
yeah.
and comments to our mark and ask them to fix their whatever issues there are, whether it's a matter of, if the food is palatable or there's not enough of it to.
I can tell you, I eat meals occasionally there and it's okay.
That's your opinion.
Right.
So,
That's
so
right.
that's one
That's right.
person who likes to eat, who likes the food, so that, we'll just get other people to.
Your clients too that like it,
Yeah,
but okay.
All right, so I think that's what the chief was just saying, if you, also, it's very nice of your father-in-law, really kind.
Pass here, Mark, to take a look at the concerns.
That'd be good. Okay, so before we go on to the next thing, I just want to recognize Chief Drummond. Thank you for coming. Appreciate it and welcome to the committee. I'm Akram Boutros. I'm the chair of the committee. So the rest of the committee, you want to just go around and do?
Sure, I'm Ted Perrin, from St. Vincent Charity Hospital and,
Very nice to meet you. Crystal Bryan, Executive Director for our Cleveland branch of the NAACP.
Chris Julian, Cuyahoga County Public Defender's Mental Health Lead Attorney.
Hi, Chief. Donna Weinberger, Greater Cleveland Congregation.
Joan England, I'm with the Mental Health and Addiction Advocacy Coalition. It's great to meet you.
Chief Bill Mason, Chief of Staff of the county. How are you, sir?
And last but not least.
Hi, Chief. Randy Carney. We've been talking a few times last few days.
So who's presenting on behalf of the Adams Board?
Our last meeting was Scott Osecki, but since that had to be rescheduled, he had a conflict, so Claire Russin
Oh,
from
great,
Adams.
terrific, terrific. Thank you, Claire, and we'll just turn it over to you.
So my name is Claire Rosser. I'm Chief of Strategic Initiatives with the Adams Board. And I'm here on behalf of CEO Scott Osecki and also our Assistant Chief Clinical Officer, Maggie Tolbert, who is also the project manager for the Diversion Center. And they send their regrets and apologies that they couldn't be here because of the rescheduling. We also have our board meetings on Wednesdays, and so they weren't able to be here. But I'm here with you today, and I'm joined by Anthony Henderson, who is our Chief Compliance Officer, and of course there are several members of the Orianna House team here as well. So if there are any questions that come up, Anthony is an expert on our data, and the Orianna House can talk about anything operationally.
Great.
All right, so I'm going to take you through, as it says, this is a year-end recap for 2021. These figures, everything you're going to see, unless I note differently, is all from the time when the Diversion Center opened on May 3rd to end of year December 31st, 2021. Okay, so to kind of take you through what we're going to talk about here, as has been noted already at this meeting, there have been some changes and some shifts to eligibility and staffing and different things. So I'm going to take you through the eligibility timeline, how that's changed, and then the three major components, contract components, that the Adams Board is responsible for, which includes the call center, which is operated by Frontline Service, Orianna House for operations, and then the CIT training that we do. And then there's just some photos and there's some pictures at the end of facility and staff that Orianna House provided as well. So that's what we're going to talk about today. Okay, so our eligibility timeline. There have been three kind of different sets of eligibility criteria. So as we know, the Cuyahoga County Diversion Center, it opened on May 3rd, 2021, accepted its first client that day. And at that time, police officers could refer individuals involved in a low-level, non-violent offense who are exhibiting signs or symptoms of a mental illness or substance use disorder. In October, that criteria was expanded to allow police officers to refer a person regardless of whether an offense or crime was involved. And other public safety forces and personnel were also included as referral sources, including fire departments and emergency medical services. Then in November, eligibility expanded to allow calls directly from individuals whose mental health or addiction symptoms are increasing and becoming unmanageable. Friends, family, or community members could also call. that's the status that we're at currently. And opening the eligibility criteria in this way, it doesn't necessarily divert from jail or from the legal system in all cases, but it does divert an individual from deeper crisis or hospitalization, which is also valuable. So after the change that was made to open it to the community, the call average increased by 212% for November and December compared to the two previous highest call months, according to the opioid settlement scorecard produced by the county. And the greatest number of calls in a single month so far was November, which I think Dr. Perry noted, when the change was made with 89 calls. Next slide.
I would comment is that in other diversion centers, December seems to bottom out. So there's a trend for December to go down in volume, and then it picks up again in January and February. So it's not unusual from other diversion centers throughout the country.
Agreed, yeah. And I'll just also reiterate something that Dr. Perry said earlier, which is that the primary focus of the diversion center obviously remains that pre-arrest, law enforcement, and diversion from the legal system for low-level nonviolent crimes. And the Adams Board meets regularly with law enforcement to provide education on that topic. Okay, so as I mentioned, this shows the 3 areas of responsibility that that is in the contract with the Adams Board, and the call center operations and CIT, or crisis intervention team, training for officers. The total contract amount from the county, as you see in the chart here, is $9.5 million, and you can also see the year-to-date expenses, balance, and percentage spent, as well as how those dollars are divided among the 3 areas of responsibility. The bottom of the chart details 2 additional investments in the diversion center that the Adams Board contributes. The Adams Board investment here is just for the 1 year, 2021, as the other pieces are. And we felt that it was important to provide additional resources to both the law enforcement officers who go through our training and the clients who utilize the diversion center. So the first investment listed as NAMI, that's for the clients. This investment provides group and educational sessions for clients provided through the National Alliance on Mental Illness, or NAMI, of Greater Cleveland. And the second investment is for law enforcement officers who go through the CIT training. We found it was a burden to police officers to take officers off their shifts for up to 40 hours for the CIT training. So we invested funds from the increase in the local health and human services levy to provide stipends to departments to cover the officers' time and training. So as part of the Adams Board's initiative to expand CIT training in the county and remove those financial barriers, for training for police departments. Departments receive reimbursement in the amount of $150 per officer per 8 hours of completed training upon course completion. And this incentive is also available for dispatch personnel. And they can decide whether they want to take that stipend or not. Most of them do. So the year-to-date expenses here reflect the space rental and training services, as well as stipends to 523 officers or dispatchers from 38 different law enforcement departments. And these investments, of course, are in addition to the in-kind investments that the Adams Board makes, including staff time for a project manager, data collection and reporting, communications, and leadership. And I also want to make it clear, while we're looking at numbers here, that we use Medicaid as the first payer source. If a client is Medicaid eligible at the time of service, Orianna House bills those services directly to Medicaid. They are not billed to us through their contract. Orianna House indicates on their monthly invoices the Medicaid funds that they've received. We then subtract that amount from the total invoice and only pay the net amount.
A question for you?
Yeah.
So the funds that are given to the officers to do the training, does that go to them or does it go to the department?
I believe it goes to the department.
Okay.
Yeah.
Okay.
Okay, so if we take a look at the 3 areas covered by, kind of a more in-depth look at our 3 areas. Next slide, please. Okay, so our first is the call center through Frontline service. This is a 24-hour, 7 days a week, 365 days a year call-in line for law enforcement and others to screen for eligibility for the diversion center. The contract includes funding for 5 full-time crisis center specialists to answer those calls. So between May and December, there were 268 total calls placed to Frontline regarding the diversion center. 181 of those calls were made by law enforcement. After 181 phone screenings, Frontline authorized 150 individuals to go to the diversion center. 87 of those calls were considered community calls that were placed by individuals in need or their friends and family. And after 87 phone screenings, Frontline authorized 78 individuals to go to the diversion center. So, of 268 total calls, Frontline authorized 228 to go to the diversion center. Of the remaining 40 callers, 27 were referred to services that better fit their needs, 9 refused services, and 4 had other circumstances, which were all different, but include things like transportation concerns.
Some of those would be, Claire, for example, when they were referred to the hospital for a higher crisis situation rather than diversion or mobile crisis.
Exactly. Because that frontline number, the 216-623-6888, that's the front door in for accessing any of these types of services or just referrals to behavioral health within the community. So if they call and they mention the diversion center, there will be a screening to see, is that actually the right option for you? And then if not, they can connect you to the resource that is.
Claire, can you just continue to ask Frontline to monitor the percent of the callers who are authorized from each area? Seems like we're about 83% from the police and a little over 90% from the
Sure.
from the family or community members, and it'd just be good to understand the difference and why we have a lower uptake from the police calls than we do from if maybe they were referred to different services, or if they were referred to a hospital or something else.
Okay.
Just good to know.
Absolutely can. All right.
And it is clear, by the way, whether you said there are 5, the contract may call for 5 full-time folks. They're not using 5 full-time people based on the amount of money they spend.
Right.
But they reduce the staff.
They relate the understaffing.
Yes, that is accurate. Next slide. Okay, so this is the Orianna House component for operations. 147 clients were served in 2021, and this is considered a duplicated count because some of the individuals have utilized the diversion center more than once. So of those, remember on our previous slide, we had 228 authorizations by Frontline to go to the diversion center. 147 admissions were completed. So that means that those clients arrived on site either through police transport or other means and completed the admission process, and it includes repeat clients, as I said. So it's important to remember that the diversion center is voluntary and a person can opt out of the diversion center even before they've arrived. They may have been authorized by Frontline and then decide against it. But the types of services that are available to those who are admitted can include diagnostic assessment, medical evaluation, case management, individual counseling, group counseling, medication management, medication-assisted treatment, withdrawal management or detox, and then those NAMI education groups, referral, and linkage. For those who completed the admission process, the average length of stay was 3.45 days.
Do you mind if the duplicated count, those are obviously clients that continue to come back to the diversion center. I don't know if it's appropriate now, or maybe Mike could say a couple things. We had a conversation about them having some continual repeat clients and working on a policy so that people don't end their 5 days, particularly homeless individuals leave, come right back 5 days, come. And so maybe just say a couple comments on that, Mike.
Yeah, and it may be better for Meg to address,
discussed that on
but when
Monday.
you have at least 1 or 2 that have come, I mean.
Frequent flyers.
Yeah. And we're trying to figure out how to still treat them in a safe manner, but put some kind of some kind of guardrails, if you will, on, look, you can't go and then come back the same day or go and, because they're signing out on their own against medical advice and they go out, do whatever, and then they want to come right back. So we've got to try to figure out a way, and I know the staff are talking about the best methods to do that, but also, you don't want to leave the person out there either. So we're kind of trying to figure that out. I don't know, Meg, if you got some comments on that.
I'll just say one thing. There are people who fall in all the cracks that are in the system and they have mental health needs or they relapse, and we understand that. And if it's therapeutic for someone to come back, it's therapeutic and it's great. We'll come up with a new plan. We'll work with them again. But we have these couple of clients who coming into our center the way that they do is not therapeutic, and it's in fact interfering with their long-term goals. Like, they will drop into us without an actual need for the services that we provide, and in doing that, they bump themselves off housing lists, or they lose their place in a more long-term environment where they're safe and their needs are met, and they can actually progress towards their long-term goals. So we want to encourage those individuals to play the long game and to not mess up their long-term process by doing the easy thing and dropping into us for shelter for a few days. So we're trying to work with them and help them realize, like, what's therapeutic. You like being here, you like the food or you don't or whatever, but you like being here for a few days, but then you mess up your whole long-term plan and we actually don't have what it takes to meet your goals. So we're trying to work with those individuals, and the best thing would be if they could come to understand that on their own, but we are trying to have some type of guardrails to prevent them from just tanking their long-term plan to take the easy way out and come for a day. If that makes sense.
Can I ask, are these people who are refusing a long-term plan? Or
They,
is it?
yeah, the long-term plan, now, I think that as a society and as a community, we need to do a better job at addressing the root causes of homelessness, and it needs to be easier to get a long-term spot than spend a year in the shelter to get on these lists and wait. So I'll say that, I'll put that on the table. I think that it sucks that that's what people have to go through, and they don't want to go through that. But when they drop into us and they actually don't have an acute crisis or a need that we can meet, they lose their progress. And that sucks too. So we're just all doing the best in the system that we have. I think we should fix all those root causes and it should be different, and then people wouldn't do this. But the few individuals that it is, they're high functioning. They don't actually have severe mental illness. One of them, my colleague and I, we both evaluated him. I did it 3 times with a fresh set of eyes every time, and she did it twice. And he's not diagnosable. He has an alcohol issue, but it's hard when we know we're not the best place and you come back, and we welcome everyone, open arms. That's what we do, and we take a fresh eyes every time. But sometimes we just know when we see your referral coming that it's going to be counterproductive and countertherapeutic for you to be with us. So we're hoping to just help them not do that to themselves.
And Dr. Testa is one of the 2 psychiatrists that work at the Diversion Center from UH.
Dr. Testa, do you have access at the Diversion Center to Unite Ohio?
Pardon me, I'm sorry.
Unite Ohio, Unite Us platform?
No.
Okay, so I think we should, Metro Health, the clinic, and university hospitals have now all paid for all the agencies, any agency that wants to be able to participate, to have access to these referrals. So you can say, this person needs X, Y, Z, and all these other agencies, I think there are 420 agencies now who specialize in housing, food, all of those things. Somebody will actually pick up the patient and say, I will help them attain this. So it's called Unite Ohio, or Unite Us is the national platform. That's Unite Ohio, and certainly at Metro Health for our Institute for Hope, we've completed over 9,000 referrals that were picked up and closed by other service providers, including legal aid and all different folks. So the entire social community, social services network in around Cleveland and Cuyahoga County is on the network. And what you will get is free access to it. Orianna House will have free access to it, to be able to enter that, we'll train you, you'll enter the information, and one of the other agencies out there in the entire community can pick them up and help you work with them.
Thank you, great,
You're welcome.
thank you.
Dr. Boutros.
Yes, sir.
Doctor, you had mentioned something about when they're homeless, that if they come into the center, it breaks their string of homeless or whatever. Can you explain that again, what you were saying?
So I'm not a social worker, so I don't want to, not explain it correctly, but you need to build up a certain number of days to get on certain lists, to get certain vouchers and get housed. So interruptions in that can bump them down lists. So.
I think it's for permanent supportive housing.
Yeah.
So it knocks you down that you didn't have as many days and.
You left the shelter.
Yeah. Okay.
Can you go to the next slide, please? Okay, so then we're going to talk about connections to aftercare. So this is what happens after an individual's stabilization period at Orianna House. 79 of those people who stayed at Orianna House received referrals to ongoing care, so that's the first two lines there, 77 and 2. And on the next slide, I'll show you a chart. You don't go there yet, Tyler, but I'll show you a list of kind of exactly where everybody went, where those clients were referred. And so you'll also see on this slide that the Adams Board is developing a system to track the number of individuals who follow through with a referral to a direct service provider. Now, primarily due to privacy laws, it's often impossible to receive valid information about client follow-up at referral agencies. However, we are working to create a system to track follow-ups to the extent possible that's compliant with all the various laws, including HIPAA, 42 CFR Part 2 regarding substance use, and the Ohio Revised Code's privacy laws regarding medical records. So right now, we have incomplete data. But we're developing that system. However, I can tell you that calls were placed to 18 referral entities, representing the majority of the referrals that were made. Not all provided information. Despite this, we were able to verify that 22 clients, or 28%, had contact with referring community provider with varying degrees of involvement. And considering that we're not getting information from probably a lot about follow-ups, that's a pretty encouraging number. So as we develop this system, we expect to have more complete information about ongoing care for clients.
Again, if you use Unite Ohio, that is something that works for you for the referrals to these folks, they have to close the referral in the system. So you will actually you may not get, it's HIPAA compliant, by the way. It has been HIPAA compliant throughout the entire country, and it's built that way. But you'll get information. So maybe just Orianna House should take a look at that instead of having to build a new platform. And it's going to be available to you for free. You don't have to develop it.
So the other numbers on here, we have 12, actually, if you could go back to that. So 12 clients either refused or did not receive connection to ongoing care. 56 clients left against medical advice. This category is described as a client who left on their own, voluntarily, against staff advice without satisfactory progress. Because these individuals completed the admissions process, they did, at minimum, have an opportunity to interact with the diversion center staff, see the facility, be a part of the program, and as Mike and others have said many times in the past, that sometimes leads to successful engagement in the future if they return to the diversion center. All right, so the next slide, thank you, is going to be tiny for you because it's a long list. There we go. Yeah, so this shows where the referrals were sent. So you can see that there were 83 referrals for 79 clients. That just means that some clients received information and connection to more than one place, more than one service or entity. Okay, next slide.
Do you know what percentage of these might be someone that's an agency that they've already have a pass with, rather than a new agency that you guys select for them? Or-
Right, well, so that's part of what the discharge planning through Orianna House, they see, is this a reconnect situation, or is this a connect to something different? So, you know, there's, I think,
That is
correct?
always the first option if the client discloses to us that they have a relationship with a previous provider. We'll contact that provider. We want to link them with somebody they're familiar with.
So this list would be reflective of those people who have been connected with them in the past, or if it's a new referral as well.
And just because I happen to be the CEO, it's just conspicuous by the absence that referrals to Metro Health. So if there's something that you need us to do, I'm happy to assist. You got everybody else. You got University Hospitals, Cleveland Clinic, and St. Vincent's. So we're the only ones not there. So if it's a challenge somehow, just let us know. Happy to assist.
Follow up with that.
Okay, next slide.
That was a commercial.
It's not. I just want to make sure I can help.
Okay, so we also did want to make sure to mention staffing at Orianna House. Now, as this, Dr. Perry covered this and what the changes have been. So what you're seeing here is really a reflection of what we think the current recommendations are going to be based on what we saw in 2021. So the contract originally included a total of 66 full-time staff members as the optimal number of staff to serve the diversion center at full capacity. However, through those lessons learned in operating the center over the 2021 calendar year, that number has been reduced to 56, but with a different composition of specialists to efficiently align those staff duties. Brandy mentioned about this earlier. And what you can see on this slide, these are the current staffing matrix based on those updates. And at this time, okay, you're gonna have to correct me, Mike, I think, I have Orianna House has about 35 staff hired?
We currently have 42 staff working on it.
Okay, 42 staff are hired. And so while that's not the optimal number if the center was routinely at full capacity, it's been an appropriate number as the center builds to capacity. And, you know, as you are all probably very aware, the behavioral health field is experiencing the same workforce crisis that every other industry is experiencing during this pandemic, and hiring and staffing is an ongoing concern, but we've mitigated it in a couple of different ways. So first, money is only drawn down from the contract if there's actual staff on site, meaning that invoicing reflects actual expenses and is not, you know, just a set amount each month dedicated to staffing. And then we've also assisted Orianna House with staffing by developing a relationship between them and the Visiting Nurses Association. The VNA can supplement staffing needs there. And Orianna House really continues aggressive recruitment and hiring promotion with the expectation that staff will grow alongside diversion center usage. And they've been very successful at making sure that all skills from various positions are available. There's no single category of staff that's not represented. There are nurses, behavioral health specialists, peer recovery, enrollment staff, etc. So that covers the operations for Orianna House. If we could move to the next. So this is the third contract component. That's the CIT training with the Adams Board. So crisis intervention team, or CIT training, that's what provides officers with practical techniques for de-escalating a crisis. Officers learn to integrate their police training with different approaches to a person that they believe may have a mental illness or substance use disorder. Role-playing is utilized to make the experience as close to reality as possible. In fact, our program greatly benefits from a partnership with Tri-C, in which officers can interact in what's called Scenario Village. Scenario Village is a public safety training space on the Tri-C Western Campus in Parma, with buildings, roads, cars, various settings, all for creating scenarios officers might encounter in their line of duty, and actors from a group called the Traumatic Players, who are experts in accurately and sensitively portraying trauma or crisis in an interactive role play are also part of the experience for the officers. And the Adams Board has provided CIT training to officers for more than 20 years, but the contract with the county has allowed us to increase the number of officers trained. So the contract also includes staff funding for 3 additional CIT trainers and 1 administrative assistant. The administrative assistant position is currently vacant after our original hire left for a permanent position, and we've not found a candidate to fill that because there's only 9 or 10 months left. It's not necessarily a desirable length of time for that type of position. But we, to solve that, the Adams Board has provided an in-kind support by temporarily adding these tasks to our receptionist duties and also having our full training staff pitch in to help. So the overall number in 2021, we trained 673 personnel related to this contract with the county. As I said, we've been doing this for a long time. That 673 personnel, they're not the only individuals who were trained in CIT this year. We also have an entire program specific to the city of Cleveland related to their consent decree, for example. And that's why you'll see the note here that the city of Cleveland officers and personnel, the county contract does not pay for those, but we are continuing to do those trainings. So Cleveland is included in the CIT training, but is not part of this particular contract. So, and that you can see that there are 3 types of training. So we do the
Can we
full.
stop you on
Wanna
that?
know the
Sure.
numbers?
I think we had 2 people on it.
Well, we want to know the numbers.
I was just gonna clarify that we, the county, have no problem and encourage, we'd like, Cleveland police officers,
Oh,
they're
sure.
welcome to be part of the contract. It's not like we separate them from the
Oh, no.
contract.
No, no,
They
no.
have a separate consent decree, and I don't know if you wanna talk about it, Chief, that they have CIT training required, but we want them, we have no problem in our
yes,
contract and
understood,
encourage it.
yes.
That is correct. We have, through the consent decree, we have a separate CIT training.
Right.
We're also through the Adams Board trying to get specialized CIT officers as well. And that's a very special program, identifying individuals that voluntarily want to get involved in that program versus having every single officer, which is about almost 1,500 now. I think it's important that we have people that want to be involved in that and have a heart for it to get involved. So that's why we want specialized CIT officers. And then that's going to be a much smaller number, but still these individuals, their heart's into it, they're going to be into it for the right reasons. So there's a separate training, but we're required through the state for a specialized training or just CIT training also through, again, Adams Board is our partners in this, and we really appreciate the partnership.
Chief, do you, because of the consent decree, do you report the number of officers trained on a regular basis, or?
Yes, sir. That's our requirements, yes.
Okay, so if there's a way for us to if you can guys locate the numbers and add
Oh,
it.
yeah, we have all those
If
information.
if everyone notices the last couple of months, those numbers of Cleveland were actually included in our report, and they're not now. It's because, and we'll have them put back in, but those numbers that have been reported on Cleveland are still being CIT training. They were just done as the separate CIT training
And
that
that's
they're
fine,
required,
you can
yes.
just,
Yeah.
one under the Cuyahoga County, one under the
Yeah,
city.
that's-
Every single
Just wanna know.
officer is required to go through CIT training, but we're trying to get specialized CIT, which is separate from that.
Did you say every officer, not just your CIT group, but
No.
every officer is required to do
Every
the
officer
CIT?
is required to have at least 4 hours of CIT training. Every officer in the city of Cleveland, Division of Police. And then we have the CIT officers actually go through 40 hours of training, which is, not every single officer requires 40 hours of training.
Is there and I hate to put this on you or ask, but is there a deadline that every officer has to at least complete the 4 hour, or is there a timeline?
December 31st, that's through the state requirements, yes.
May I ask Chief
Yes.
Drummond, I heard in the MRAC meeting that Captain McPike was such an integral
Yep.
part of this, and he's retired as of this week?
Next week.
Is there somebody?
We are in the process of putting that out for anticipated assignment, we call it, internally. And we're hoping to get some candidates, some strong candidates for that. But yes, he's leaving next week. Once he's done, then we're going to put the anticipated assignment out.
Okay, so Chief, just also that's something you may want to look at as you're looking at a forward Shaker Heights Police is doing a pilot with Recovery Resources, in which the behavioral health specialists are going out for any calls that may seem that they are in behavioral health or addiction calls, and they're going out simultaneously together. We don't have a lot of data yet. It just the program began last month, and they're going out there with them. The behavioral health specialists are going out there to meet with them.
We have a co-responder, as you're aware,
Yeah.
that we have the co-responders in Cleveland as well. Not the recovery specialists, but we have counselors with our office to respond to crises.
Dr. Boutros, I did get a call from the fire chief from Shaker, to your point, the program they're doing, and because of that, they requested if a fire chief could take our CIT training class because of that co-responder program that they're working through.
Claire, just to be clear though, the training that their police are getting from the consent decree and the training that we're giving for the diversion center, they're not the same thing.
Well, so there are different types of training that go. So we've got the 40-hour training, that's the in-depth training. And
That's the
actually,
That's, yeah, right, which is the same.
That is the same?
Yeah,
that's the same. And that's something that I'm trying to remember. We just had, I think, 2 week-long sessions with Cleveland. My point with mentioning Cleveland is that Cleveland's not being left out. They have an established program here. It's just not part of this particular set of numbers because it's not part of the contract.
No, it wasn't intended that way. I mean, Cleveland is our clientele for this diversion center primarily. And so we would like to have as many officers trained and receptive and open to this whole process. That's why I mentioned it, nothing more than that.
So the
Because we
40-hour
know,
training.
I think we all know that we should be getting more of these individuals from the city, and we're not.
Right.
Do you remember how many we have this year?
70 OU classes this year, but so far 73 are trained.
It is in 22, you mean, or 21?
Sorry, sir.
She means in 21.
Yeah, the full year is
2021,
I'm
not
thinking.
2022.
Anthony will pull it up if we can. If not, it's an easy enough number to pull and we'll get that full number to you. It's been an ongoing program.
Can I ask to Bill's point, for the 4-hour training though, the reduced training, that's not just your specialized CIT group, but all your
Every
officers?
single officer.
Does
right.
that does include a section on diversion? Like I know the 40-hour does. Does that 4 hours that's given to them at least include the section on diversion?
I can check and get back to you on that because I
that'd be
think that,
important.
I think that education about the diversion center has been integrated into all the law enforcement trainings
I know
that
it's
we're
in a
putting
folder,
forward.
but it'd be nice if they could talk
Yeah,
to
but I
them in
think
front of them.
there's actual, there's a segment on it. I just don't want to misspeak, so I can definitely check that as well.
Since we have the Cleveland Police Policy update next,
Right.
why don't we just, we'll talk about all these wonderful things.
Let's jump on you, man.
Don't
So-
run.
so this
Okay.
way Claire can get off the hot seat.
Yeah.
So I think, was that your last slide, Claire, I think?
Oh, no.
Okay. Now it's pictures.
Now it's pictures,
Yeah.
okay. Now it's pictures. However, I will point out before we move on to the pictures, there are 3 different types of CIT training. We can talk about this as well. There is the full 40-hour training that certifies an officer as a CIT officer, a dispatch training specifically for emergency dispatch staff, and then a refresher for people who've been through CIT before but need a refresher on skills or it's just been a little while. So we've been providing 2 40-hour CIT trainings per month, along with 1 8-hour dispatch and 1 8-hour refresher training per month as well.
Can I ask a quick question before we move on? I know time is brief. For a while now, I think the entire or full board has kind of been requesting these type of figures. While we are grateful for the raw data and analysis that you're providing, giving us totals and what this means to the group, not that we're cognizant or conscious to do one, but that would be great. So can we get this kind of report for us so we know what proper questions to ask and where we can serve and help you? Because without this, we're looking at a bunch of numbers. And again, you know, each one of us, someone else pays our salary, so we got limited time, and this would be really, really useful for us.
First, this was the response to the request that
Is it, okay, so we'll get it?
Board to do these, to do them in a much more presentation fashion than the raw numbers.
Can we get a hard copy of it? It would be great to be able to read through ahead of time. Thank you.
We'll just ask them for that. Yeah. Yep. Yeah. So we just, can you repeat it next time, please? For the next quarter, just the next quarter.
Oh,
Have a
sure,
similar
sure, sure.
presentation, quarterly
Sure.
presentation.
Quarterly presentations
Yep,
is what?
and, instead of just the raw data, which you have behind all of this stuff. I'm sorry, I received this, did not everybody receive this ahead of time?
I don't have it, could it be?
Okay, I received it, before I left the office today.
I think I received it.
Alright, so we just have to get it.
Thank you.
Yeah, and it might have to come through a Dropbox link, because the reason we didn't put everything on one email was because it's too big of a file.
Alright, we'll figure out the logistics.
Yeah.
And it's too big of a file because next comes pictures.
Yes, okay. Let's look at the nice
So you
pictures.
can, Tyler, you can just kind of scroll through these. It just shows, different areas of the facility, different staff that are on site. And I'm happy to take any questions. And again, we've got Anthony here as our data expert. I know he's been working with Brandy about the formats, and it sounds like we're wanting to have something that's a little bit more like this format as a presentation on a quarterly basis, which I think is
Very helpful.
is doable. And any questions for Orianna staff, house staff as well?
I just comment that the facility improvements that have been spent, I mean, clearly looks like it's been well done and well, I think offers the respect that all the clients need. So, good job. Any other questions, comments? Okay, Chief, how are you?
Welcome here, Scott.
It's
Good job.
I'm good.
So the chief of police usually sits next to me to protect me. So just, should you want to
It's the other
comment?
way around.
Yeah. You know, I first, thank you to you and to the mayor for taking our questions and input and approach to this and suggestions. You know, as on the committee for healthcare that was brought up with the new mayor, and I think all the staff was very receptive to having these discussions. So thank you for being very open to working with the Diversion Center and making it a success. So with that, I'll just turn it over to you, Chief.
Thank you, I appreciate it, and obviously Mayor Bibb and I are on the same page, and want to be as receptive and collaborative as possible. Ultimately, our goal is to make sure we can help people. As my philosophy as a law enforcement officer for almost 33 years now is, we can't arrest our way out of some of these situations and so forth. And when folks are in crises, it's important that we try to get them to the proper help that they need. And I think the Diversion Center is one of those avenues, so we fully support it. As you know, the policy's changed, and I think it's a good idea to change the policy. Again, Mayor Bibb supports it, I support it wholeheartedly. Before, I believe, we had to talk to the prosecutor before and some other things. That's no longer a requirement. Doesn't have to be a criminal nexus involved in it whatsoever, which is absolutely ideal. So if our officers run across someone that's in crisis, whether it's mental, whether it's drug abuse, alcohol abuse, and so forth, and the folks want to voluntarily go to the Diversion Center, our officers will transport them there. That's part of our policy and so forth. And obviously, if there's some type of criminal nexus involved in it, we have our policies, and I have our policy with us because we updated it and made sure that our folks are aware of it. Obviously, if there is some type of criminal nexus, and it's not something where they won't be eligible, since it's a felony, escalating misdemeanor like domestic violence and things of that nature, obviously then those individuals still will be diverted to the center. We still have our reporting requirements, so we still have to complete reports and so forth. So again, we've adjusted our thought process and our policies to make sure that we can help as many people as we can.
And did that go into effect?
I'm sorry?
Do you know when that went into
This went into effect January 17th. January 17th. So my responsibility as the interim chief is to make sure that our officers embrace this philosophy and get more participation, to Bill's point, to get more participation. Talking with Brandy, and so forth, which I appreciate. Brandy, she wants to get more of our officers trained, not just on the 4 hours. She wants to get them trained on the 40 hours and so forth, and we talked extensively about how we can get that accomplished and so forth, and there's some ways of doing that. However, we can't get we have full staffing, 1,640 officers. We're down again quite a bit, almost 200 officers we're down. But I would like to get all of our officers trained, not necessarily 40 hours, make them specialized CIT trained officers. There's an agency, which is in Memphis, Tennessee, who have been doing it for many, many years. And they're a relatively large police department. I think they have more officers than we do. And I believe, and I could have the numbers wrong, I don't want to put numbers out there and give you wrong numbers, but I think maybe a third of their department, if that many, are specialized CIT officers. And again, the rationale and the reasoning behind that, based on national studies, is you want to get someone that has the heart for it. And generally those individuals are individuals whose family members, friends, spouses, relatives, and so forth, or probably have some type of crisis, whether it's abuse issues or mental health issues. They really want to help people. Not saying the other officers we have don't want to help people, but these individuals, again, have a personal stake in it. So, again, through national standards and practices, that's why you don't have all officers trained that way, because not all of them respond the same way. That's why we want specialized CIT officers and so forth. So we're not going to have all 14 or 1,500 officers trained through the 40 hours. I'd say years ago, again, with our partnership with the Adams Board, we had quite a bit of officers trained through the 40 hours. We had somewhere up 500, 600 officers who were actually trained for 40 hours, but that was many, many years ago. I don't think all of them should have been trained that way, to be honest with you. But, so every single officer in the Division of Police, including myself, all command staff, will go through at least 4 hours of training, and then we'll have the others will go through the specialized CIT 40-hour training. So again, it's very important to me, it's very important to my command staff, it's important to the mayor that everyone is trained in CIT. And again, for me, it's my job, my responsibility to make sure that our supervisors understand that down to the troops, that they understand that and they utilize this resource that's out there. So we're pushing that through our roll calls. We're pushing that through my management meetings and so forth, to continue to push it out, that they should start utilizing that, especially if someone's eligible for the diversion center. Yes, ma'am.
So first, I just want to commend you on your new role. We are very grateful to have you here.
Thank you.
And also commend you all on changing your policy, which makes it very helpful for us to meet the goals that we are trying to accomplish as a board and as an organization. The second thing I just wanted to ask is, may you all consider maybe in the future, should the numbers not go up, the ability to incentivize the officers? And I understand what you're saying, you want people who want to do it, but certainly it might help with an extra push or cushion, as they talked about earlier when giving the report from the Adams Board, that some officers get paid to attend training, and recognizing it wouldn't necessarily be a whole lot, but if you had your special group as time goes on, it may be an opportunity to look at it if we have those additional levy dollars that are being pumped into this activity. And then just the third thing, just want to know if we can offer ourselves as a small maybe planning team to think about what ways or methods we can ensure outreach to you. So it may be hard for you to talk about it in a group where you're there to police, but if we can offer it, we have varying backgrounds even before here. I worked at the Adams Board before, I've been a counselor before. So if there are ways for us to get together and kind of sell or pitch to you as a team, be happy to, if that's allowed through our chair and those who provide the funding and resources.
Sure, absolutely. Again, I'm open to just about everything and anything to help increase our capacity, increase the amount of officers that are trained. Again, have them voluntarily get into specialized CIT, I think is the best way to do it, but if we can incentivize it, I'm open to that as well. Sorry, go ahead, Brad.
Chief, I was just going to ask quickly, your policy, and if you don't know this, that's okay, but your policy does not include felony offenses, obviously, and escalating misdemeanors.
Right.
And so we just wondered on the escalating misdemeanors, is that something that you would still allow for the diversion center? It's just case by case, or not at all? Because some of them.
Yeah, some of them we're talking about domestic violence, we're talking about menacing by stalking, so we're talking.
What was the one, yeah, there was one that I can't recall what it was,
Or
but.
physical control.
It was one where I would assume that you would be able to send someone to the diversion center, and so that was just why I wondered whether or not it was a case-by-case basis or just none of them were
It's
allowed.
pretty solid, so it's kind of a line drawn in the sand for certain ones. And any sex offense as well.
Absolutely.
Donna?
Yes, ma'am.
Chief, I just wanna underline what Bryant was saying in terms of we very much in looking at the models across the country and how they've gotten there. It's very clear that, there's a steep curve that has to be gotten to. And when you look at other models, they really make an effort to meet monthly with the staff at the diversion center, with people like us at the board, to really try to work through these impediments, whatever they are, and to understand them better. And I think that we really do want to offer ourselves to make this facility the place that people can go to. And I guess what I'm not clear on too is with a 4-hour training, like what exactly is happening in terms of talk about the diversion center?
I haven't gone to the training, so I can't speak to that. But there is mention in the training about the diversion center as well. Again, exactly what's said, I'm not sure, because I haven't gone through the training yet.
So I just say to you that, there are clearly two sides of the, getting the numbers up, but maybe multiple. One is that you cleared the way with your policy for additional folks to get there, and I think there is the positive reinforcement that folks are talking about here, both whether it's in pay to go for the CIT or additional recognition that they've done the right thing regarding this. But and just training large number of people, I can tell you is that there are some folks that this didn't catch. Whatever was said, it just didn't hit home for these folks. So I was just thinking maybe if there's a way for us to look at the folks who come to the jail, and if we believe that they would have been better served with a diversion center, that we can send you that data, send you that information and say, it looks like we had 25 people get referred to the diversion center, and there may be another 50 people who came to the jail that time, and here are the data on them. Here's the precincts, here the time of day, time of night, officers, and that would help, I think, if we can do it, and we should be able to give you both individual intervention. Officer Jones, it seems like, in the past 3 months, you've sent 8 people to jail and not to the diversion center. Do you want to learn more about it? That kind of thing. So I think if we do that, I think you'll get both the positive reinforcement and to look at the negative, the folks who are naturally just typically going to jail.
I would love that information.
Yeah.
Right.
Doctor, that's great because starting at, we're saying, March 31st or May 31st, the central booking in the current jail will be up and operating and running. Bob has been heading that up for a year now, working on it, and it's really getting fine-tuned. And so those that get missed at the front end with the officer on the street will have a second opportunity in the central booking to catch them. But to your point, keeping that data, and I think that's a great idea, to let the officers know that, hey, maybe there's something you should be looking at. And I think after a pattern is developed with the prosecutors making those decisions, everybody will get to learn and see what is acceptable and unacceptable, and it'll work better also. But so, just to say it out loud, Prosecutor O'Malley is considering felonies too, so certain ones. But so when the police make an arrest and they're going to arrest them on a felony, the prosecutor is going to review that in the central booking and make a determination whether we should send them back to the diversion center.
Yeah.
So
we
we're on the cusp of a lot.
have Intercept 0 done now, we have Intercept 1 done, and this would be Intercept 2. So, and I would just say it's not just Cleveland Police Department. If we can
We
look
did
at
make
this.
a data request to the jail, and they're working on that right now. They sent us a file last week, and they're making some changes and updates with your Metro staff, and so with exactly what we're talking about, the
And
police
if we can
data
just
and
share it
data.
with all the police departments so that they can take whatever actions they can. And some of it just plainly, it's not top of mind.
Yeah.
People see somebody and they're creating a disturbance. And if you've been doing this for 20 years, the natural instinct is to take them to the jail, and that's what you do. And without saying, you know, you could have done this, saved yourself 40 minutes and gone back on a lot easier, and all of that, that would give them some input. I'm sorry.
No, that's okay, thank you. Just 3 quick points. To that point, I'm looking at our friends from the Public Defender's Office who might also have some really good insight into people at the jail who might have benefited by an interface with the diversion center instead. The second thing is, I just want to emphasize what Donna said and the critical role that Captain McPike and his predecessor have played in all of this. As the co-chair of the Community Engagement Subcommittee for the MRAC, I can tell you that's what moves things forward in the community. And then the final point, to your point, Dr. Boutros, about the 40 minutes, can the folks at Orianna House give us an update on what is the amount of drop-off time currently, the average drop-off time?
The average amount of time it takes between drop-off and the officer being able to leave and get back on the road, it's 5 minutes.
Was that
right
6
around.
minutes
Great.
at most for a couple months there? Yeah, I mean, 6 days.
For me,
It's
it's,
fast.
for me, it's, again, all the things that we're talking about here and with the officers, again, making sure they understand, first of all, the policy, that's important, that there is a change. And when we change our policies or update our policies or revise our policies, we generally send them through training for that. It's a learning management system. So they go online, they look at the policy, they take a couple questions and so forth, make sure they understand the policy. And then through our in-service training, also through roll calls and so forth, that reiterate the policy. They're read several days, and every single roll call, all 3 roll calls and so forth for at least 7 days. And it's something I can do again, because again, tomorrow I have a staff meeting with the command staff. And the last command staff, I talked about the policy, I talked about making sure our people are taking advantage of this and taking folks who are eligible to this. So I'll stress that again tomorrow at our meeting with my command staff, and then for them to stress it with their captains and their lieutenants and so forth, and to the roll calls, and continue to push that out. Because I too, when I see the numbers, I'm very surprised that the numbers for the city of Cleveland is very low. To be honest, it is very low. So we know there are a lot of folks out there in crisis that can use the diversion center. And for me, and again, if I didn't say it before, and maybe I lost my train of thought, I prefer not to arrest folks. I really don't. Unless, I mean, there's some folks out there that need to be arrested, and we'll do that and so forth. But for me, if someone's in crisis, I prefer for them to get help. That's my philosophy. My people know my philosophy and so forth. And just getting to our troops is really important. That's something I'm stressing. I'll continue to stress.
So let's give you some real numbers. 61% of the time, it takes less than 5 minutes for the officer to be there. 91% of the time, it's less than 15 minutes. I knowing how long it takes to book in the jail, this is a much quicker. This is a much quicker trip.
You're absolutely right, and I can appreciate
Just
that.
the parking.
Right, no.
Just the parking is much easier.
You're right, and I think that's important to understand, and with our officers, a lot of time in various things, they're tied up so long, like taking kids to juvenile, that takes
So
forever.
61% under 5 minutes, 91% under 15 minutes.
Great if we could host a open house at the diversion center for the Cleveland Police, and maybe levy catering.
Thank you,
Not
thank you,
everyone.
Donna. All right, just one last thing I think we have, which is, again, thank you, Chief, the Community Input Committee, and who's going to report? Okay? Yeah, of course, absolutely, Rosie.
Thank you. Hi, my name is Rosie Palfy. I'm a member of the City of Cleveland Mental Health Response Advisory Committee, which was created under the consent decree. I want to thank Chief for coming. I had the pleasure of meeting you at the safety meeting a few weeks ago. thanks to the leadership of the Adams Board, we met for the first time in January and created a community input committee. We voted and we have 7 members. One of our co-chairs, Larry Heller, is here. And we've held open a position for a youth representative, an adult with lived experience from the Jail Coalition. So we've met twice. We met in January and February. Recommendations we wanted to share was we want to focus on open access for both the temporary and the permanent diversion center. We want to add a diversion point at central booking, which it sounds like you've already done. Thank you very much. We would also like to explore a sequential intercept mapping process and look at intercept zero, which is before somebody's in crisis calling the police. So we would like to do that and have a process map that's specific to Cleveland and Cuyahoga County. Also, provide the community with regular updates on the jail building project and jail-related data, use jail and diversion center usage data to inform decisions. And then also, we're very passionate about juvenile diversion. And we have a juvenile diversion subcommittee on the Mental Health Response Advisory Committee. And so as a committee, we are trying to prioritize both adults and juveniles and trying to find a way to address juvenile diversion. Can I say a couple other things?
Sure.
Dr. Boutros? Excuse me. So I have this binder here. This is 8 years, thanks to the Adams Board. This is 8 years of crisis intervention data. These are our annual reports, 8 years of annual reports. So from 2014, January 1st to December 31st of 2021, total, I crunched these numbers earlier today, 15,282 crisis incidents that were documented, and that's probably an undercount in 8 years. And 2%, probably less than 2%, were arrested. So I just wanted to share that with you because I don't think that you're ever gonna find 50 people at a time to fill the center that are pre-arrest. Does that make sense? And you know, if you want to see the data, we can share it with you, but the majority.
Share that data for us that was the first meeting when you brought that to, and we did share it with everybody here.
Right, and we have a new report, and from last year, and it says 114 people were arrested, but last year, but only 4 were taken to jail. So last year, there were 4,889 incidents. So 114 people were arrested, but only 4 went to jail. And a lot of times what'll happen is somebody will have an outstanding warrant. So they're not committing a new crime, but the officer has to take them to jail. So I wanted to share that with you. And there's a couple things that were said earlier that I wanted to clarify. So the stipends to the police department go to the police department, and it's not directly the officers to defray the costs of overtime. Okay, make sure that you all knew that. We are working, the Mental Health Response Advisory Committee, we worked with the City of Cleveland and the police department to create the 4 hours of annual in-service training. So this year it's gonna be homelessness, and we're working to complete that. It's not done yet, hasn't been submitted to the court, but I can definitely take back to the training committee your concerns about making sure there's some training in there about the diversion center.
Great. Well, thank you also for sharing your reports. It was included for everybody to read. I'm gonna just counter your point about the 2% who less than 2% that went to jail. On the jail side, receiving people into the jail, a lot of people are at arrest points are in crisis and that don't seem to belong there. On the receipts, I'm not sure where the data disconnect is, I don't know if they called for crisis intervention or not, or the people were taken straight to jail. But at a certain point in time, we looked at 30% of the population in the jail did not, in our estimate, did not need to be in jail. So I'm not sure where the data disconnect is, but there seems to be clear number of people who either, as you wanted and we agreed to, the zero intercept point, which exists today, the community can call the diversion center and send somebody over, and so that's the zero intercept point. Intercept point number one, which is pre-arrest, which is what we built this on. Now intercept point number two, which is post-arrest. We'll look at that. I think that from our work in the diversion centers and the places we saw, that was almost the complete amount of referrals from the different diversion centers. So now with a very highly cooperative and supportive police chief and mayor, I think we'll see about the numbers and see how it goes. And if we don't need a 50-bed diversion center, that's nice. That would be nice for us to have. So thank you very much. Thank you. Are there any?
Chris Julian brought some in.
Actually, Tyler had asked me to bring somebody about the homeless issue, but we really didn't have any new information.
I think it came up just quickly, at the last meeting, it came up about metrics, that, we could use some of the metrics to inform and getting some information, and I think Bill had mentioned that your office might have some of it.
Well, and this is Ben Miller. He is the head social worker in our office, and he worked on any of the homeless stuff. I don't know if it's easier to talk about it here or just to work with him and figure it.
So I think if we work with Brandy to look at some data and see if there's, as Dr. Testa said, that if there's a group of people who are having recidivism as a result of homelessness, and we can identify that, maybe we can support the process further.
So I can follow up with you. Like I said, we requested the jail data, so should also have that by the next meeting, but I'll follow up with you now on this data.
Sure.
Thank you.
There's an additional problem with homelessness is keeping up with their medication. Often they leave it, lose it. It's at someone's house, so if they come to the diversion center in a crisis, they haven't been on their meds for a number of days or weeks. There is a large number of homeless people that come to the Orianna house.
Is there any new business? I don't think there's old business, right? We took care of that. Okay, so I'll call the meeting adjourned. Thank you very much.
This was our best meeting.
Because I'm unmasked.
That's nice to meet you.
Because I'm unmasked, that is wrong. Now I feel.
There you go.
It's like an old county worker. I'm going out like, Lord, I don't know.
Do you have parking there?
Chris, I'm Rosie.
Let me go grab some. I'm gonna go grab some before,
I'm
yeah.
not so comfortable with referring some people to the diversion center. I just want to know.